you today?
Good.
My name's Andrew. I'm just going to do an assessment on you. I just want to make sure that you are satisfied with the privacy I've provided for you, closing the window and the doors and everything, and that you consent to this assessment and that you understand that you can refuse any part of it.
Yes.
Okay, very good. Well, let's get started then. We'll just start at your head. I'm going to have a look at your face. The skin of the face appears normal. There's not any discoloration or anything. I'm going to have a look at your scalp. Tilt your head down for me. All right, let me see the back of it. Okay. Visual assessment of the scalp doesn't reveal anything abnormal, no alopecia or anything. I'm just going to palpate your scalp. Palpation of the scalp and cranium, I don't feel any lumps or abnormalities. Did you feel any tenderness when I was pressing at all?
No.
Okay, very good. So I can tell just by looking at you that your expression is symmetrical. We don't have any drooping to the left or right, so your face is good and symmetrical. We'll go ahead and feel the temporal arteries on the side of your head. All right, both arteries, I would say +2 pulse, very good. We'll move down to your jaw and assess your temporomandibular joints. Can you open your mouth real wide? Very good, and close it. Okay, there's not any popping or crackling or anything like that. When the TMJ is opened, I'm going to test the sensation on your cheek, which is your cranial nerve 5. So close your eyes for a moment and tell me which side of your face the cotton swab is touching.
The left.
Very good.
Right.
All right. And I'm going to assess the strength of your jaw against resistance. So just clench your teeth as tight as you can. Very good. Okay. So cranial nerve 5 checks out fine. We'll move to cranial nerve 7, which is the muscle use of your facial muscles. So go ahead and smile for me and frown. Squint your eyes very tightly. Close them all the way. Squint them really hard. There you go. And raise your eyebrows really high. All right, show me your teeth and puff your cheeks out. Very good. Cranial nerve 7 is intact and functioning well. So we'll go ahead and move to your eyesight and we'll assess your cranial nerve 2, which is your visual acuity. So go ahead and stand over there against the wall. And right there will do. Cover your eye, cover your left eye first. And let's start with line 7.
FELOPZD.
Okay, go ahead and read line 8.
DEFPOTEC.
All right, give line 9 a try.
LEPODFCT.
Okay, looks like your right eye stopped at line 8. So cover up your right eye and we'll do your left. Let's start with line 7 again.
FELOPZD.
Very good, and line 8.
DEFPOTEC.
All right, give line 9 a try again.
LDFODPOT.
Okay, both eyes seem to stop at line 8, which will give you 20/20 vision. Very good. I'll take that for you, and you can have a seat again. So cranial nerve 2 checks out fine. You have very good vision. We'll move on to cranial nerve 3, 4, and 6, which is the movements of your eye and your pupils. So I'm going to shine this light in your eyes. Okay, the pupils in this light were about 4 millimeters and dilated together with good accommodation down to about 2 millimeters. So your pupils have good accommodation. So cranial nerve 3 checks out very well. So we'll move to the movements of your eye. So as you just follow my finger with just your eyes. Okay, very good. The extraocular eye movements are great. I didn't see any problem. Both your eyes move together. Good accommodation. I'm going to have a closer look at your eyes. The conjunctiva is pink and moist. The sclera is white, no yellowing, no redness. The irides and the corneas don't appear damaged or cloudy, so it looks like you have pretty good eyes. Close your eyes for a moment. I'm just going to gently touch the outside of your eyes and check the structure. Do you feel any tenderness when I do that?
No.
Okay, very good. No abnormalities with your eyes either. They're nice and round. They're not bulging out or sunken in. Your eyebrows look fine. I don't see any abnormalities with your eyelashes. So I would say you have very good eyes. So we'll move over to your ears. And I'm just going to have a look at each ear. Turn your head for me. Okay, and turn the other way. So no abnormalities with the ears, just on a visual assessment. I'm going to just feel them a little bit. Okay, they're nice and cartilagey. So we're going to test cranial nerve 8, which is your hearing acuity. So I'm going to whisper a number into each ear, and I'd like for you to repeat it back to me. Okay?
99. 99.
Okay, very good. So you have good hearing, you passed the whisper test, and cranial nerve 8 checks out just fine. So we'll just move on to your mouth. I'm going to shine another light at you. So let me see your teeth. Open your mouth. There you go. All teeth appear intact. No discoloration at all. The gums appear pink and moist. The buccal mucosa, which is your cheeks, is pink and moist. I don't see any abnormalities. The tongue is good, pink, moist, no white patches. The hard palate looks good. Lift your tongue up for me. Soft palate looks good. Floor of the mouth. Open your mouth one more time. I'm going to have a look deep back. Stick your tongue out for me. Alright, the uvula appears normal. The pharynx, I don't see any redness. Can you say ah? Very good. The uvula retracts as it should. So, stick out your tongue some more. Move it around. There you go. So cranial nerve 9 and 10, the uvula and the gag reflex check out. I would grade the tonsils as a +1. They don't really pass very far into the pillars of the throat. Your gag reflex appears good, your uvula contracts as it should, no abnormalities in your mouth. So your cranial nerve 12, your tongue function appears to be normal as well. So we'll move on to your neck and make our way on down. I'm going to palpate your lymph nodes. So just tilt your head up just a bit. There you go. We're going to start with the pre-auricular lymph nodes, which are not palpable. We'll go to the post-auricular. Okay, and let me know if you feel any tenderness. The occipital. We'll go to the submental and the submandibular. And the tonsillar. We'll go to the superficial cervical. Go to the posterior cervical. And we'll go to the deep, and they're pretty far in there, so I'm going to press. Okay. No deep cervical. And then we'll have a feel for the supraclavicular. Okay. And no lymph nodes are palpable, so there's no swelling or large lymph nodes. I'm going to check your carotid pulses one at a time, so I don't choke you. Okay, left carotid pulse is a +2, which is normal. Right carotid pulse is as well. And I have to listen to your carotids just to make sure that you don't have any strong blood flow that's abnormally strong. We'll start on this side so you can see. Okay, hold your breath for me. Okay, you can let go. Okay, hold your breath for me. Okay, very good. There are no bruits when listening to the carotid arteries, which is good. Your blood flow is normal. So we'll go ahead and what we can do so we stay in range of the camera is we can swap seats, and I'll let you sit here and face that way, and I'm just going to have a listen to your back, okay? So let me move this chair right there, if that's okay.
Yes.
Let's see. Scoot that way just a bit. There we go. Okay, so we'll do a quick visual assessment of the back. I don't see any abnormalities. I'm just going to lift your shirt up just a bit.
Okay.
Any abnormalities on the posterior chest. I'm going to just palpate a little bit. Do you feel any tenderness at all?
No.
Okay. I'm going to place my hand on you and ask you to say a number, and we're going to test for tactile phrenitis. So, which is basically how the sound is traveling through your body. Okay.
Okay.
Say 99.
99.
Okay.
99.
Very good.
99. 99.
Okay. So far in all 4 areas, tactile phrenitis is present. Go ahead.
99.
Okay.
99.
All right. And I'm going to go a little lower.
99. 99.
Okay. So tactile phrenitis was present in the upper portion of the posterior chest, which is normal. We should be able to hear the air going through your lungs and absent down here. So I'm just going to percuss your lung fields, and we're just going to check just to make sure that we have the resonant sound that we want. Okay, so far so good. Okay, so far we're good and resonant. And not so much down there. All right, so I'm gonna kind of hit kind of hard right here on your lower part of your back. It's just to check the costovertebral angle for any kidney tenderness.
Okay.
So just let me know if you feel any tenderness, okay?
Okay.
So the cost of vertical angle doesn't show us any tenderness, negative for tenderness. So we're not looking at any kidney inflammation or anything like that. So I'm going to have to listen to your breath sounds. I ask you just breathe normally for me. Okay, very good. I don't hear any abnormal lung sounds. Lungs sound good and clear. So we can swap places back, and you can sit back on the couch, and I'll get back in my chair. So now we're going to move on to your arms. I'm just going to put this up for a second. We're going to move on to your arms. We'll start with your shoulders. So I'm just going to have a look at your arms in general. You just hold them out for me. Okay. I don't see any abnormalities. We do have good muscle tone. Skin seems to be good and intact. Test skin turgor on each hand. The skin snaps back to normal less than 1 second. So your skin turgor is good. You are well hydrated. I'm going to assess your pulses as well. So we'll start with the brachial pulse. Very good. And then we'll move on to the radial pulse on the outside of the arm. And the ulnar pulse on the inside. Okay. Both pulses on the right arm are +2, appear in normal limits. Brachial on the left arm is +2 as well. The ulnar and the radial on the left arm are normal and +2. So you do have good pulses. Capillary refill is good, so circulation in your arms is normal. So we'll go ahead and check your range of motion. We'll start with your shoulders. So you sit up straight, very good. Can you take your arms and put them above your head? Very good, bring them forward. Okay, and can you bring them all the way behind you? Very good, okay. So flexion, extension, hyperextension of the arms is normal. You take one arm across to the other side, very good. Adduction is good, and take it back out. And abduction is good with the right arm. And do the same with the left. Adduction with the left shoulder is normal, and take it out. And abduction with the left shoulder is normal as well. So no shoulder problems to speak of. So we'll check the range of motion for your elbows as well. So just hold your arms out for me. Alright, the elbows flex fine. You bring them in, they flex fine and extend them back. There we go. Can you turn over to pronation and supination? Alright, very good. So range of motion is fine. I'm going to test your resistance, your strength against resistance. So hold your elbows out, about right there. Okay, bring it down some. Alright, can you bend them in? Bring them up. Very good. Alright, bend them a little bit. And press down. Very good. Strong arm. So range of motion with the elbows checks out, no problems. Let's see your wrists. Alright. Can you hyperextend them up and flex them down? Alright. Spread your fingers, make a fist. Very good. Can you take your thumb and touch it to each finger? There you go. Very good. And the other one? Alright, cerebellar function appears good in those respects, and range of motion is fine. You take your finger of either hand and touch your nose. Very good. And do the other. Very good. So we'll go ahead and have a look at your reflexes. So I have the reflex hammer, and since we're kind of across from one another, I'm going to sit next to you, and we'll check your tricep and your bicep and your brachial reflex. So bring your arm up, turn it down just a bit. There you go. Very good. This is tricep reflex. Okay. And the brachial reflex. Very good. The bicep reflex, I'm sorry. And the brachial reflex. Okay, very good. So the right arm reflexes appear normal, +2, good reaction. See the tricep reflex. Okay. And the bicep reflex. It's very good. And then the brachial reflex. Okay, very good. So reflexes of the arms, tricep, bicep, and brachial reflex check out just fine. So we're going to do a cerebellar function test. It's called the graphesthesia test. And what I'm going to do is I'm going to put an object in your hand, and you just feel it and tell me what it is. Close your eyes. Hold out your hand.
Key.
Yes, very good. All right, and I'm going to put one more in your hands. Close your eyes.
Paperclip.
Very good. All right, and we'll go to your left hand.
Coin.
Very good. And we'll do one more.
Key.
Very good. All right. So graphesthesia is normal. We're going to move on to the stereognosis, which is another test of your ability to feel and recognize objects and patterns. So hold your right hand out. All right, close your eyes. I'm going to trace a symbol in your hand, and you just tell me what it is, okay?
Okay. Figure 8.
Very good.
Letter B, uppercase.
Very good. All right, we'll do the other hand.
Figure 8. Uppercase B.
Okay, very good. So your cerebellar function is great. No problems, abnormalities there. So we'll move back from your arms to your chest, and we'll go back to having a look and a listen. So we're going to start by just doing a visual assessment of the anterior chest. And just looking, I don't see any work of breathing, no difficulties. Everything appears normal, rise and fall of the chest. I'm just going to palpate just a bit. Okay. You feel the rib structure underneath. I don't feel any pulsations or PMI in the pericardial area. No heaves or thrills are palpable. So we'll go ahead and have a listen to your heart sounds. And we're going to listen to each valve as it opens and closes your heartbeats. Okay, the aortic valve sounds normal. Pulmonic valve is also normal. The tricuspid has no abnormalities either. And we'll listen to the herbs point as well. And then the mitral valve sounds good. So heart sounds sound fine so far. We'll listen to the other side of the stethoscope to check for any murmurs. Good. Aortic and pulmonic valves are normal. Tricuspid and the mitral valves are normal as well. So your heart sounds good. There's no signs of murmurs or abnormalities, no clicking or double beats or anything like that. So we'll go on and move on to your abdomen. So do you mind laying down with your head that way? Very good. Okay, are you comfortable enough?
Yes.
Okay. So we're going to start, I'm just going to roll your shirt up just a bit. Okay, I'm going to pull your shorts down just a bit. There you go. Okay, so we're going to do a visual assessment of the abdomen. It appears symmetrical, no abnormalities with the skin. I don't see any peristalsis or anything that would appear abnormal. The umbilical area appears normal. There's no sign of a hernia at all. So we're going to go ahead and just have a listen to your bowel sounds. And we'll start with the lower right quadrant. Okay, bowel sounds are present. And the upper right quadrant also has good bowel sounds. The upper left quadrant and the lower left quadrant have good bowel sounds. While I'm here, I'm also going to check each side for your renal arteries and check the center for your aorta. And we don't anticipate to hear anything, so we'll see. So the right upper and lower area for the renal arteries I don't hear anything abnormal, no rushing of blood, bruise at all. The left renal artery sound is absent. I don't hear any bruise there either. And we'll listen to it for the aorta. In the center of the stomach, which is not audible at all either. So I'm just going to do some light palpation and press into your stomach a little bit to check for any distensions. We'll start with the right lower quadrant, and let me know if you feel any tenderness at all.
Okay.
feel any distension so far. And no tenderness. So we'll move on to deep palpation. We'll just press a little bit deeper and see if we can feel any organs down there. And while I'm in the right upper quadrant, I'm going to palpate for the liver. And I can just barely feel it under there. So it's not coming out further than it should be. You didn't feel any tenderness when I pressed. Okay. Deep palpation of the left upper quadrant. I can feel the stomach, but it's where it should be. It's not distended or dilated. No presence of the colon abnormalities. As far as we could tell, your abdominal organs are normal. So if you like, you could sit back up. Oh, and before I forget, let me see your stomach one more time.
Okay.
Okay. I'm just gonna percuss one more time. Okay. It does sound good in tympanic, which we kind of did that out of order, so we could have moved things around just a bit. But it does sound normal. So we'll move on to your legs. I'm sorry to sit you up, but I need you laying back down one more time. Okay, so you can. Okay, fine. Okay, so lay your legs out for me. We're just gonna have a look. Yeah, go and get comfortable. Okay, so a visual assessment of the legs doesn't show anything abnormal. Do you mind if I take off your slippers?
I don't.
Okay. Alright, so looking at the legs, I don't see any abnormalities. We're just going to check for anything that might be abnormal. Do you feel any tenderness as I palpate?
No.
Okay. Coming down to the shins and the ankles, I don't see any pretibial edema. Let's see. I know you had said in the assessment that your ankle had been a little sore in your shin. How's it feeling now?
It's fine now, but I haven't been on my feet a lot today. So.
Okay. Well, right now it doesn't show any signs of swelling. Definitely no redness. Feet appear normal as well. So we'll go ahead and check your range of motion with your legs. So I'm going to ask you to, we'll check the range of motion of your hips. I'm going to ask you to raise your leg one leg at a time at a 90-degree angle, just all the way up. Very good. Okay. And the other leg. Very good. Okay, can you bring your knee to your chest? Very good, okay. And the other one? Very good. So we'll check the rotation of your hip as well. So take your right leg and can you rotate that leg outward? Very good. And inward? So eversion and inversion are good on the right leg. Do the same with the left. Eversion is normal, and inversion is normal as well. And can you take your right leg and cross your left leg? Very good. And then take your right leg and move it that way. I know there's a couch in the way, but okay. So adduction and abduction with the right leg are normal. Do the same with the left leg. Adduction is normal, and bring it out. Abduction is normal as well. So now we'll just go ahead and check your pulses and your reflexes. check the popliteal pulse, which is just behind the knee. Left popliteal pulse is present. Give it a +2, it's normal. The right popliteal pulse is present as well. We'll check the posterior tibial pulse. On the left is present. And the right is present. The posterior tibial pulse is checking on the inside of the end of the tibial bone. So we'll also check the dorsal pedis pulse on top of the foot. Okay, left dorsal pedis pulse is normal, and right dorsal pedis pulse is normal. So I'm going to check the range of motion. Range of motion for your hips and your knees appear normal. You can bend your knee just fine without any difficulty. So I'm going to move down here and check the range of motion for your feet. So can you just rotate your foot inward? Okay. Inversion of both feet is normal and outward. Eversion is normal as well. So I'm going to check your strength against resistance. Lift your feet. Very good. Good strong feet. And stand on your toes. Very good. So strength of the feet is normal. While I'm down here, I'm going to test your Babinski reflex. You see your foot. We'll go from the heel all the way up. I know it tickles. Okay, and no abnormalities. The toes curl just a little bit for being ticklish, but a bad Babinski reflex would be your toe curling one way and your other toes going the other. So in that respect, it's normal. And we can further test the Babinski by going on the inner sole. Very good. And across the middle as well. And we have no reaction on the left side. All right, heel to toe. No abnormalities. Babinski reflex appears normal. Okay. All right, I'm done taking a leaf for now. So I'm gonna go ahead and check your reflexes. Can you sit up for me? Alright, so we're going to check the popliteal reflex. And I'll tell you what, let me get over here so I don't block the view. You can just keep your leg relaxed. Very good. Okay, popliteal reflex is present. We'll check the Achilles reflex. Very good. Very good. Okay, so we've got your reflexes, legs appear normal. You said that you had injured that leg years ago in your history. I don't see any abnormalities with it today. So let's go ahead and finish up with just a little walking assessment in your balance, cerebellar function, etc. So stand up for me. There, you can put your slippers on if you like. Okay, so I'm going to ask you to walk from the table to the wall over here on your heels, and then walk back on your toes. Very good. And walk back on your toes. Very good. And so we'll go ahead and do the Romberg last. We'll test the muscle strength of your legs. So as if you can. Stand on one leg. Let's start with your left since it's the uninjured one. Okay, and can you hop on one leg? Very good. All right, and do the right. Okay, and how's that feel?
It feels fine.
Okay, and hop a little bit. Very good. So while you're standing up, I'm just gonna have to look at your spine. So I'll come over here, turn around for you. You bend forward, all the way. Okay. So the spine doesn't appear to be protruding at all. It has good curvature to it. So I don't see any abnormalities with the spine. Okay, you can stand back up. So we could go ahead and do the Romberg test. I'm just going to ask you to stand still and close your eyes for about 1 minute. Okay? Go ahead. Okay, very good. You seem to have good balance. You didn't have any shaking or difficulty standing up. So we're going to do a quick range of motion test. Can you bend over and touch your toes? Okay, stand up. Can you bend sideways like a tree? There you go. Other way. Very good. Can you bend backwards? You don't have to go all the way back. Okay, very good. And then can you turn your shoulders to each side? A little bit more. How much? There you go. Very good. Okay. So essentially that concludes our assessment. Thank you for participating. You appear just fine. I don't see any abnormalities with your leg. Everything sounds good, looks good. So I guess we're done.
Thank you.
Thank you.